Hello, courageous humans, and welcome back to the show that takes the phrases everyone is whispering and says them out loud at full volume with biological context attached. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has heard two words spoken more apologetically in her clinic over the past 2 years than almost anything else in her career. Ozempic face. People say it softly, almost carefully, like they are confessing something, and Dr. Lazuk's response is always the same. No, you don't have Ozempic face. You have weight loss, and your face is adjusting. Dr. Lazuk is not with us today because she is currently at a metabolic aesthetics symposium in Zurich, Switzerland, having accepted an invitation to present on what she described as the most misframed conversation currently happening in aesthetic medicine. She delivered her presentation. Attendees are describing the response as the collective exhale of an entire field that has been waiting for someone to say this clearly. She has since agreed to co-author a clinical framework on post-weight loss facial recalibration, review 2 unpublished studies on GLP-1 associated tissue change, and apparently rewrite the symposium's entire closing panel because she felt it was still using the wrong vocabulary. She has been given full editorial control. Everyone agrees this was the correct decision. We have sent a return flight. She has acknowledged it thoughtfully and done absolutely nothing about it. So, you have the avatar, and today we are dismantling a phrase, understanding the biology behind it, and replacing panic with something considerably more useful. Let us start with what the internet got wrong, because it got one thing profoundly wrong, and that one thing is causing real harm to real people who made a healthy choice and are now sitting in front of mirrors feeling like they broke something. The internet framed rapid facial change as damage. Dr. Lazuk sees recalibration, and those are not the same thing. Here is the actual biology. When the body loses weight, whether from GLP-1 medications, illness, stress, or significant dietary change, it does not selectively protect the face. Fat pads in the midface, temples, and jawline deflate along with everything else. Some of those fat pads are superficial, some sit deeper, acting almost like internal cushions that support light reflection and contour. When they shrink quickly, two things happen simultaneously. Shadows deepen, and ligaments look looser than they actually are. That is it. Not accelerated aging, not structural collapse, not a cosmetic curse attached to a medication. Rapid change exposes architecture. The face that was always underneath is now more visible. And visibility is information, not damage. Here is the distinction that Dr. Lazuk considers the most important thing in this entire conversation. Volume loss and tissue laxity are not the same thing. Someone comes in and says, "My skin is sagging," and when we look closely, the skin is not necessarily sagging, it is unsupported. The scaffolding underneath changed. The surface simply followed gravity because the internal cushion disappeared. Imagine a pillowcase stuffed full, smooth, firm, structured. Now remove half the filling overnight. The fabric did not age, it did not fail, it just lost internal support. The pillowcase is fine, the stuffing changed. This is where the viral conversation causes genuine harm, because when people believe something is damaged, they panic, and panic in aesthetic medicine produces a very specific and very common mistake. Immediate filler, everywhere, fast. And while volume can absolutely be part of the solution, rushing to replace metabolically active living fat with static supportive gel is not a one-to-one exchange. Fat is alive. It compresses when you smile. It rebounds. It responds to hormonal shifts. It contains vascular and biological signaling components that filler simply does not. Filler is supportive material, different biology, and when we rush to replace everything at once, we overshoot. We correct shadows that were partly inflammatory, partly transitional, partly lighting. We create density instead of support, and density reads older. Patients do not always articulate it directly. They say something softer, something like, I don't look bad, I just don't look like me. And that is the moment Dr. Lazuk knows the conversation needs to slow down considerably. There is also an inflammatory dimension that almost nobody discusses publicly. Rapid weight loss is metabolically stressful. Hormones fluctuate, cortisol shifts, nutritional absorption changes, hydration patterns alter. The body is reorganizing itself at a systemic level, and inflamed or stressed tissue does not integrate volume elegantly. It bruises more easily, it reflects light harshly instead of softly. It makes hollows appear more dramatic than the underlying structure actually warrants. What someone calls Ozempic face is very often a combination of deflated fat compartments, temporarily stressed collagen, fluid redistribution, and lighting exaggeration, not structural doom, a transition, and transitions deserve strategy, not panic. So, what does the intelligent approach actually look like? It starts with a question that is different from the one most people are asking. Not, how do we put everything back, but what does this structure need now? Those are very different conversations with very different outcomes. The answer is almost never add everything immediately. It is almost always rebuild support first, and support does not always mean filler. When weight loss has been rapid, tissue often needs strengthening before it needs bulk. Biostimulators, treatments that encourage the body to lay down new structural collagen gradually, respect the architecture of a face in transition. They build from within, slowly, subtly, without imposing volume onto tissue that has not yet stabilized. Think of it as reinforcing the internal framing of a home before deciding what belongs on the walls. You do not hang heavy artwork on walls whose studs have just shifted. You reinforce first, then you decide what the surface needs. Then comes inflammation control, calming the systemic stress that rapid change created, allowing the face several months to metabolically stabilize before any aggressive correction is attempted, adjusting skincare to reduce barrier stress, ensuring nutritional support is adequate. This is not glamorous advice. It does not produce dramatic before and after photographs, but it works, and it works in a way that holds rather than creating the subtle heaviness and slight static quality that rushed correction almost always produces. Only after tissue has strengthened, inflammation is controlled, and the new map of the face is properly understood. Do we place volume? And we place it differently, not to recreate a past version of the face, but to support the version that is emerging. Subtle mid-face restoration that softens shadow without puffiness, temple support that rebalances proportion, jawline contour that reestablishes the frame, rarely dramatic, always architectural, always restrained. The most beautiful corrections are the ones nobody notices. The face looks rested, balanced, coherent, not filled, not erased, just itself again, with better support. Here is what Dr. Lazuk wants you to carry out of this episode clearly and without apology. Ozempic face is not a diagnosis. It is a cultural reaction to rapid change, wrapped in language that makes a biological transition sound like a cosmetic punishment. If you lost weight and feel healthier, that is not something to apologize for. Your face does not need to be fixed. It needs to be supported in its transition, intelligently, patiently, with a strategy that respects what the tissue has been through rather than reacting to what the mirror shows in unflattering bathroom lighting at 7 in the morning. Aging is not the enemy. Medication is not the enemy. Inflammation and impatience are. When we slow down, strengthen structure, and rebuild thoughtfully, rapid weight loss does not age you, it simply changes your blueprint. And blueprints can always be refined. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual facial structure or weight loss experience. Facial changes following significant weight loss are complex and individual and deserve professional evaluation by a qualified physician before any treatment decision is made. For more information and tools to better understand your skin, visit SkinDoctor.ai. And if this episode made you feel considerably less panicked about your face than you did 12 minutes ago, please like and subscribe. We will keep replacing viral misinformation with biology that actually makes sense. Dr. Lazuk would thank you personally, but she is currently in Zurich rewriting the vocabulary of an entire medical symposium and cannot be interrupted for anything less urgent than a structural recalibration emergency. May your skin always glow as brightly as your smile.